Good afternoon. My name is Dr. Charles Ethan Arevalo. I'm a dermatologist. And when I say dermatologist, I treat skin diseases. My topic will be about acne. Now first, we want to know what is acne. Acne. You may hear the term breakout used to describe all forms of acne, but this isn't always an accurate description. Now all types of acne spread across the skin. Clogged pores cause an acne itself. This may be attributed to excess production of oil, sebum, bacteria, hormones, dead skin cells, and ingrown hairs. When too much sebum is produced, it can fill and plug hair follicles. This causes bacteria known as Propionibacterium acnes or P. acnes to grow. The bacteria then get trapped in the plugged follicles. This can result in skin inflammation, which leads to acne. Symptoms of acne include whiteheads, blackheads, and pimples. Some cases are more severe than others. Many factors contribute to the development of acne, including hormone changes, genetics, diet, stress, and infection. Acne starts when oil and dead skin cells clog up in skin pores, causing inflammation. Many factors contribute to this condition. Acne is usually associated with hormonal fluctuation experienced during your teenage years, but adults and anyone can experience this too. About 17 million Americans have acne, making it one of the most common skin conditions among both children and adults. Identifying which type of acne you're experiencing is key to successful treatment. Acne may be non-inflammatory or inflammatory. Subtypes of these acne within these two categories include blackheads, whiteheads, pimples. There are different kinds of pimples. These are papules, pustules, nodules, and cysts. It's possible to have multiple types of acne at once. Some cases may even be severe enough to warrant a visit to the dermatologist. Non-inflammatory acne includes blackheads and whiteheads. These normally don't cause swelling. They also respond relatively well to over-the-counter treatments. Salicylic acid is often marketed for acne in general, but it usually works best on non-inflammatory acne. It naturally exfoliates the skin, removing dead skin cells that can lead to blackheads and whiteheads. Look for it in cleansers, toners, and moisturizers. Blackheads. Blackheads occur when a pore is clogged by a combination of sebum and dead skin cells. The top of the pore stays on despite the rest of it being clogged. This results in the characteristic black color seen on the surface. Whiteheads. Whiteheads can also form when a pore gets clogged by sebum and dead skin cells. But unlike with blackhead, the top of the pore closes up. It looks like a small bump protruding from the skin. Now, inflammatory acne. Pimples that are red and swollen are referred to as inflammatory acne. Although sebum and dead skin cells contribute to inflammatory acne, bacteria can also play a role in clogging up pores. Bacteria can cause an infection deep beneath the skin's surface. This may result in painful acne spots that are hard to get rid of. Products containing benzoyl peroxide may help reduce swelling and get rid of the bacteria within the skin. This can also remove excess sebum. Your doctor may prescribe either an oral or topical antibiotic along with the benzoyl peroxide. To treat your inflammatory acne, topical retinoids are also an important part of combating inflammatory papules and pustules. Papules. Papules occurs when the walls surrounding your pores break down from the severe inflammation. This results in hard, clogged pores that are tender to touch. The skin around these pores is usually pink. Pustules. Pustules can also form when the walls around your pores break down. Unlike papules, pustules are filled with pus. These bumps come out from the skin and are usually red in color. They often have yellow or white heads on top. Nodules. Nodules occurs when clogged. Swollen pores endure further irritation and grow larger. Unlike pustules and papules, nodules are deeper underneath the skin. Because nodules are so deep within the skin, you can typically treat them at home. Prescription medication is necessary to help clear this up. Your doctor or dermatologist will likely prescribe the oral medication isotretinoin or Sotret. This is made from a form of vitamin A and is taken daily 4 to 6 months. It can treat and prevent nodules by decreasing all gland size with the pores. And cysts. Cysts can develop when pores are clogged by a combination of bacteria, sebum, and dead skin cells. The clogs occur deep within the skins and are further below than nodules. These large red or white bumps are often painful to touch. Cysts are the largest form of acne, and their formation usually results from a severe infection. This type of acne is also the most likely to scar. The prescription medical isotretinoin or Sotret is commonly used to treat cysts. In severe cases, your dermatologist may surgically remove a cyst. What can you do? It's important to be patient with your treatment. While some treatments may work immediately, you may not see widespread improvement for several months. You should also use caution in using too many acne products at once. This can cause dry skin. In response, your pores can create more sebum, then leading to more acne issues. You should also confirm whether any bumps or swelling are actually the result of acne. Seeing a dermatologist is the only way you can receive a full and accurate diagnosis. In some cases, expert treatment may be the only way to fully clear and control your acne. Now, I will discuss the 6th way to treat pimples. Avoid the urge to squeeze and pop. The act of trying to squeeze out the pimple ultimately worsens inflammation, which can make the area more tender to touch. It may even become more noticeable from increased redness and marks on the skin. Attempting to pop pimples can also cause scarring. Now, the second way is to apply a warm compress. Warm compress can help in healing acne in a couple of ways. First, they can help ease the pain from the acne. They're especially helpful once the whiteheads begins to form. Apply the warm compress 10 to 15 minutes 3 to 4 times a day. This can allow the pimple to release the pus and heal. Wear an acne sticker. An acne sticker is like a bandage that you place directly over the pimple. In theory, the sticker helps remove bacteria, sebum, and dirt. Ingredients can vary, but most acne stickers contain an acne-fighting agent, such as salicylic acid. The 4th way is to apply antibiotic. Topical antibiotics can help get rid of any bacteria that's contributing to the pimple. They can also reduce inflammation. If you get recurring blind pimples, such as products may be used around the affected area as a preventing measure. The 5th way is to apply tea tree oil. Pure tea tree oil can't be used until you dilute it first. To do this, mix 1 part tea tree oil with 1 part carrier oil. Popular carrier oils include coconut, jojoba, and olive oils. Pure tree. After dilution, apply to the affected area and leave on overnight. Rinse the area in the morning during your usual face washing routine. Tea tree oil is safe enough for daily use. It's only harmful when ingested. Now, the sixth and final way is to apply raw honey. Raw honey is another natural alternative to OTC products. Honey has natural antimicrobial properties that help you get rid of bacteria. To use this method, make sure that your products contains raw honey. You'll want to avoid the typical honey you can get from the grocery store. Apply a small amount to the affected area and leave on overnight. Raw honey can also be mixed with water as a cleanser. How to prevent future breakouts or acne? Some of what co- co- what some of what causes acne isn't under your control, such as genetics and hormonal shifts. However, there are a number of things you can do to help prevent breakouts. Wash your face, but only twice a day. Lathering up more frequently can irritate the skin and lead to more oil production and breakouts. Second, use products that contain benzoyl peroxide or salicylic acid. This can help dry out any oil clogging your pores. Benzoyl peroxide also helps kill acne, causing bacteria. For body acne, wear loose fitting that lets the skin breathe. And the fourth way is to keep your hands off your face. Picking at acne may lead to scarring or more acne. Now I'm done with my discussion and fact set board.